ahead.
Just a little bit of history. We started in 2008. We opened our doors on September 16th in 2008. It was a group of individuals, physicians, some nurses. At the time I was a teacher in Lancaster, and I began as a teacher after being in healthcare for about 20 years. So always served with the homeless population. And as we could see kind of like a downturn economically for the community, I saw more and more people on the street, people behind the mall and behind Target living on the land. And so I just kind of was like aware of it. My husband also has done healthcare for the homeless, was most recently on 60 Minutes. So he and I just started, like searching out like a team of people that would also be interested. And so that's how we began. Dr. Henry Hood was an orthopedic surgeon in Lancaster forever. And just like he joined in with us, and I had served on the board at Maywood Mission, and I knew the basement was available if we could kind of do like a quick rehab. So that's where we started. And that's where we've been ever since.
Let's see if I can change this.
This is just the first and third Tuesday of every month. This sign goes out up at the street in front of Maywood, just as people drive by going to and from work. We just want to make sure that they're aware that we're open, and we just try to hit any place that we think a population in need would be. We put our flyers out all over the community, social service agencies, job and family services, the library. I drive through windows because a lot of food service workers only have part-time hours and have no insurance. So I'm just trying to hit the population that needs us. Just a picture of whoever was here that night. Dr. Scoggin is in this photo. He's the far right, and he's our medical director. Everybody else in this picture, a lot of these individuals have been volunteers at the clinic for over 10 years. And, we just keep coming together to take care of people. We are a charitable organization in the state of Ohio since our inception. Almost everybody who volunteers at the clinic also has a full-time job or works part-time. We are trying to reach the most vulnerable people who either have no way to get care, or we also live in an area that is underserved by like primary care physicians. So we have a lot of people in need, but they can't get into a doctor. So regardless of what the barrier could be, if you need care, you get care. We don't ask for any qualifying measures. We just simply are here to give free health care. This is just a quick, easy summary of what we do. We provide a lot of medication and prescription assistance. We've had people who've been coming to the clinic for, again, over 10 years because they just come sporadically. So we have charts on individuals as far back as, 2010. Lots of folks with high blood pressure, diabetes. We also do education for these chronic diseases and management of those. We have a partnership with Mount Carmel for diabetic education, like prevention. So we do A1C testing, and if you qualify, you can go into an education program to help you manage pre-diabetic conditions so you don't keep going. The other thing I think is really important is that we have a huge amount of resources. So we help folks get to where they need. what they need. This just tells you that we're a member of the National Association for Free and Charitable Clinics. We're a member of the Charitable Healthcare Network of Ohio, which used to be the Ohio Association for Free Clinics. We have been from the start. We are recognized by the Ohio Department of Health and receive some funds from them. They're uninsured care funds. I write grants and beg for money and anything we can get to just keep us going. It's been great. United Way has been with us every step of the way. They've just been such a strong supporter of our initiatives. The Fairfield County Foundation, Fairfield Medical, Mount Carmel Health System. We have churches who have always, been willing to help us out when we need specific things or just provide hospitality the night of clinic. This just kind of gives you like a little snapshot, like every clinic evening, we have at least 10 volunteers. They greet patients and family members. We have folks who have provided meals. Like we try to always, well, we did before COVID, we've always had like food for anyone who came. If people are in need of food, like on an ongoing basis, we make sure that they get to the Maywood food pantry. If they need coats, we make sure that, there's a follow-up to, if they have a need, we try to identify what it would be and meet that need. Pictures of a bunch of servants. This is a really cool picture because the little, the young woman on the upper left on your screen was one of my students. And what I try to impress upon people is that a volunteer can be a high school student. A volunteer, you guys can check this out and see if this is a place, if you're interested in healthcare, if you think you might, God's calling you into a life of serving those and in the world that need healthcare, this is a really good place to just sit and learn. And you're also very much protected. I mean, I'm very careful that students are, mentored with someone on staff. They don't have direct patient contact. They're a hospitality worker or they work with me, on the administrative side. But I always want, I want the kids in our community to see that your community is you. So you have a role. Just shows you that we really do look like a doctor's office. People come in and go, this is like so cool because I'm in and out of here in like 20 minutes. My doctor doesn't, so they always tell us how much they love that we just, move them right through as quick as we can. And please understand that because we are, everybody's a volunteer, I don't want to tax their time and have people, here till 9 or 10 o'clock at night because they've been working all day. So we really are streamlined operation. It's very, we just have this little side door to the side of the building. So I want to make sure people see, don't look for a big sign out of the road. It's not a medical office building. You park in the parking lot at the church and you walk over. Or if you can't get here and you can't walk over, we'll come to you. Just more pictures of folks getting taken care of. That's Dr. Hood, who was our medical director for many, many years. And so it shows us, Dr. Hood. You see our hospitality counter where folks can come and get snacks if they want coffee, whatever. We always try to have something good. We also have a prayer room. If people are just saying, can somebody just sit down with me and pray with me, or can they just, it's there if they so choose. This is just about students, why they would want to be there. You can skip this. This is two students that volunteered at the clinic, and they are just telling their story, what they could do. And, you know, this was Mrs. Barthelmess trying to recruit more students to come to the clinic. I need servants. So 2 success stories. Another success story, and you can skip Emma. She, what was really cool about her though, is that she's now a pharmacy student at Ohio State. And when she tells in her little clip that she's a PCA up at University Hospital. And so at the time I asked her to make this for me, she had worked on the neurology floor as a PCA, and that was the floor that they converted to the COVID unit. Mm-hmm. So she, it was a very, really emotional. So we'll just keep going.
Oh, I missed one. Gotta go back.
That tells where we are. This is
Here we go.
During COVID. This just lets everybody know you don't need to make an appointment. You don't need to call. Just come to the clinic. We're here for you. The next slide is during COVID. Once, you know, we got over the shock of, you know, being down all of April. Well, it hit in March. And so we just kept waiting. We made sure that all of our patients, we had reached out through social media to let them know, you know, call this number. If you need us, call this number. So we could still make sure if there was any prescription that they needed, if they needed immediate care, what they should do. But once we made it through April, we went into we started doing the drive-through clinic where you can see that's our medical staff triaging in the parking lot, and also just, you know, making sure that patients are taken care of. So we just went car to car. It was, people were trying to give us food orders, and it was like, no. So it was awesome to just be able to be back with the folks again that knew, like, as long as by the way's there, we're going to drive into the parking lot and get what we need. Okay. And you're done. All done.
All right.
Just when you thought you knew everything there was to know about
I think it's still going to play. Hold on just a second.
Just shut it down.
There we go.
Thank you.
So what are the income guidelines? So if someone wanted to come in, like, do they need to show proof of income, or how does that look for you guys?
We have on their intake form, the front part is just consent for treatment, and the back is the guidelines for poverty in the state of Ohio, families, you know. They just read through that and they sign off that they qualify. We don't ask them, I need to see, you know, your pay stubs, I need to see where you live. We do not research any of that, because what we've learned over time, and this is from the National Association and the State Association. Do you hear kids screaming? Because they're out on the playground. Sorry.
I have dogs barking, so I'm not worried at all.
I'm so sorry. I'm like,
no
really, they're having fun. I promise. No, we don't ask for any type of qualifier. We have people who live on the land. We've had people with no ID. And we don't ask for it. They go, I don't have an address. You don't need one. So it's, we don't want to create a barrier by saying, well, sorry, you're just a little bit over the poverty guidelines, so we can't help you. You know, we've had people show up that are just like, I can't get into a doctor, you know, and they need, you know, they could have strep throat, just something simple or an ear infection. And they've tried desperately to get in. They don't want to miss work. So, you know, some of it is just like this urgency that I have a job and I need can you guys please help me with an antibiotic? Sure. I don't have $50 to pay at the Minute Clinic or wherever. And we understand that. So it's like, we don't even ask. It's like, you've read the guidelines, please sign off that you agree. And they sign off. And you know, people will even tell us, like, I have a doctor, but they can't fit me in. Well, it's okay. Why are you here? No one, and this is where I think no one has taken advantage of us. We don't have, you know, the people that are like, well, you can really go to By the Way, and they're just like, thank you so much. And that's it. We'll never see them again. So it's like, that's why we're here. You have a need and you need help. That's why we're here.
That's awesome. And I wasn't even aware of By the Way Clinic until Andrea Spires, I'm part of United Way too. I'm on one of the councils, and she said, oh yeah, like they've been there for years and years. And I had no idea. That's why I was
Yeah.
interested to have you on the call today.
I served on the health council for a few years, and all they kept hearing was, by the way. And I said, me sitting here, I feel like it's a conflict of interest because you guys are going to say, who needs money? And I'm going to say, by the way, free clinic. So I don't want there to be a conflict of interest, but I want you to keep telling people about us, because you may not have that need, because you might have insurance or Medicare or whatever. Someone who does. I promise you, someone who's going to be like, I don't have, go to the clinic. Just type in free clinic in my area and it'll pop up.
Mm-hmm. How did you come up with the name, by the way?
By the way, I was in church and we didn't have a name for the clinic. And I was just like, okay, everybody that's been called to this point has acknowledged that God brought us here. And I was just like, okay, God, I don't know what you want us to call this clinic. And it was that Jesus is the way. And so we were made by the way. So, and also, along the road to Emmaus, or the woman, somebody who has a need, they're like in the Bible, the story is like, they're standing there, they have a need. And it's like, stop and help them out. So people use the phrase, by the way, all the time. Mm-hmm. And so when they say, by the way, I always go, it's a free clinic in Lancaster, Ohio. So they're like, really, this is kind of lame. And I'm going, you know what? We were made because, God called us together, and he is the way. So it's by the way, that's who made us, and continues to keep us going. So we're grateful.
I wondered that ever since I heard about it. I'm like, I wonder where that came from. In the chat, I have a question. Do you care for mental wellness in addition to physical wellness at the clinic?
Yes. It's more difficult, but it's usually a referral, or somebody will have medications that they need. And so we always try to work, like, who prescribed, where are these coming from? We do not prescribe any class 3 meds. So our medical director or the medical team will always be like, okay, where do we need to go? Who do we need to research this with? So we make sure this person gets what they need. Okay. And yes, all ages. We've had babies come through the door, and kids that are in high school that mom got home from work and this is what she found. And she's like, this isn't an emergency room situation, but can you help us? Yes.
Awesome. Kristen said, it's fantastic. What a huge blessing. Can you repeat the days that you're open again, like your hours
Sure.
in the clinic?
We are open the first and third Tuesday of every month, unless it's a holiday. We open the doors before 6 o'clock, like usually like 5:30, 5:45. It depends on when the whole crew shows up, but we are open definitely by 6, and we're open until 8. I know people have asked, well, can you be open more frequently? And if we have more physicians or PAs or nurse practitioners volunteer, then yes, we could open more days. But right now that's, based on our volunteer team, that's we can manage the first and third Tuesday, and we've been that since day one.
Okay.
I have a question. You said that if a person couldn't come to you, you'd go to them. So obviously you would do in-house visits with maybe someone who may not drive or be older, or?
Usually what happens is they'll have somebody bring them and they sit in their car in the parking lot, or a truck in the parking lot. So we haven't ever gone to anybody's house. We tried, Maywood Mission said we could use their bus, and we tried going to the foundation dinners, and I had like all of our information at the foundation dinner. And the bus would go down, and if anybody who came to the dinner on clinic night needed a ride, we could pick them up, bring them down for care, and then take them to where they needed to be dropped off. So we did that for a few months, and then it just kind of like the foundation population. I know they still have people, but they didn't need us. So we just kind of weaned off of that. And then, COVID has just sent everybody into like, now what are we going to do? So we haven't really, I'm sure we'll come back and revisit. Do we need to be going back to the foundation dinner on the bus? I don't think we've ever gone to anyone's home. I know that Steve, since he does a lot of, he's on our board, and you saw him in a bunch of the pictures. He's the guy that's at this truck window doing triage, but he does healthcare on the land in Columbus. So he's very much proactive in, there's a population living in this location, and Steve will be like the person who's like, I'll go check it out and see if anybody needs anything. So it's almost kind of funny because it's like he's triaging out there on the street. Or if we see someone on the street, he just like stops or turns around in his car and goes back and says, hey, do you need anything? Because it's just like, that's his comfort zone. A lot of volunteers are not comfortable with that. So we just kind of rely on Steve, and Todd's another person. Steve and Todd are the ones that are really the homeless, the camp situation folks.
Okay, thank you.
Sure.
I don't have any other questions in the chat. Does anybody else have anything they wanted to ask?
If you guys, I don't know, Rachel, if you can provide my email to everybody, just that if you guys need me to send a flyer, like one of our brochures, I can send that over. If you know of a place that you're like, they really need these there, then tell me, and I'll make sure they get there. If you go to church, tell everybody at your church. So like, I'm just like, tell anybody that'll listen to you, just tell them there's a free clinic in Lancaster, Ohio. And I can assure you it's very safe. I've had people say, oh, it's on the west side of Lancaster. And I'm going, guys, we have like lights in the parking lot. We will walk you to and from your car. I've been trucking in from that parking lot since, 2000, and here I am. And I'm going, you're fine. We'll make sure you're safe. So it's grassroots. It truly is. So if you think like, well, I don't think someone's going to wander up to you, or you're going to drop off food at a food pantry and go, whoa, they need to know about this. And that's why I tell everybody, please just get it out there. Tell people we're there. Google us, by the way, free clinic, and it'll pop up, and send them. Just keep them coming.
Also, in addition to you guys, right there by the Maywood Mission, they have a thrift store as well, right?
Yeah,
there's a couple different resources right there in one spot.
Yeah, because I started off as the president of the board on Maywood Mission, and that's how I knew about the basement. And at that time I went to Pastor Tony and I said, that basement, can I have that basement? And he goes, it's filthy down there. And I go, no, I promise you, you're going to see what can happen. And he was, this obviously, here we are, but I was part of the team that made sure we built the new community resource center, or the thrift store and food pantry. So when people have a need for food or something that they need in their home or their shelter, I just go, let's go. We can go straight up the driveway. And if you can't get it tonight at clinic, I've got your contact information. We'll make sure you have it this week.
That's awesome.
Or sooner.
Do you have a phone number for contact?
This phone number for clinic?
Yes.
740-6546. I'm going to check this because I never call it. I'm so sorry.
Okay.
Like, oops.
I get it.
I should know it by heart. Why would I? Okay, 740-654-6911.
Thank you.
Sure.
Okay. Well, Kathy, we really appreciate you being with us today and giving us that information. And the recording from today will be on our YouTube channel. I will also send that to you so that you could send that out to give other information out as well. And then I can also attach the slide that has all of the information with the phone number and
Great.
how to come in contact with you. So I'll add that on there as well.
Awesome.
And if you could stay after the call when other people leave, I have an opportunity I think you might enjoy. So
Okay.
if no one else has any other questions, we can finish up for today.
Thank you so much, you guys, for just listening. And I appreciate anything. You'll be amazed at something will happen and you'll have to know all about us. And now you do.
Thank you so much.
Thanks.
I want to remind you guys next week on the call, Dorinda is going to be back and talking about Medicare and Medicaid eligibility and type of plans. The following week, we're going to have Teen Works, and on the 29th, Alley Park's going to be back. They're going to do a fun program about bird watching. So that's what's coming up for virtual community in the next couple of weeks. So I hope to see you guys there. See you all soon.
Bye-bye.
Thank you.
We'll give it just a second.